Welcome to Raise the Line with Osmosis from Elsevier, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the pandemic and beyond.
Hi, I'm Shiv Gaglani. We've heard many stories on Raise the Line about patients and their family members who, upon getting a rare disease diagnosis, build a nonprofit organization from scratch to boost advocacy and research for the condition in question. This is obviously a pretty big hill to climb for people with no background in such things. Well, today we're going to learn about a nonprofit designed to help provide the expertise and support needed to get a rare disease patient group off the ground and to connect these groups with each other for the purpose of mutual education and support. I'm delighted to welcome Dr. Rick Thompson, who's the CEO of Beacon for Rare Diseases in Cambridge in the United Kingdom. Beacon was co-founded by one of our previous guests, Nick Thoreau, whose two sons were born with the ultra-rare genetic condition alkaptonuria, also known as black bone disease. Dr. Thompson has a background in evolutionary biology, research and education, and in his current work, he is particularly interested in the issue of drug repurposing for rare diseases. So Rick, thanks so much for taking the time to be with us today.
No, thank you guys. Really excited to chat and get the invite.
So we like to start by asking our guests to just explain in their own words about their background. So in your case, what first got you interested in natural sciences and evolutionary biology?
Yeah, that's a good question. I think biology was always one of those subjects I just really enjoyed right from back in the school days. I like that connection between science and the life that you see as a person, right? You can connect the scientific things you're learning about to your own body, to the processes you're seeing in the world, and some of those quite interesting things that are happening in the world around us. So I think I always wanted to follow that through, and that led me to natural sciences at university, which let me keep things quite open. I really liked all the different types of biology, and I thought I was going to go, all off into biochemistry and genetics, because that's the thing that really attracted me early on. But then I kind of wound up at university and began to take a few courses in evolution, and it was a fascinating topic that kind of embraced the history of biology, where everything came from and why things work the way they work. And that was really exciting. There's a kind of a storytelling arc to it as well, a narrative that I always found really appealing. And it brought back that love of dinosaurs as a 4-year-old, that kind of thing that threw into it as well. So I find it a fascinating topic that explains why we're here as well as how it works, which I think was great.
Yeah, 100%. I agree. And it was a nice intersection of actual hardcore science, the biology, the genetics, as well as just sociocultural aspects, as you mentioned. Why did people migrate to where they did, and how that impact their genetics over time?
Yeah, absolutely. And it all feeds in this really complex way, which is great. And I ended up doing this very complex multidisciplinary kind of PhD route, which had things from paleontology through into molecular genetics, and to combine that together was quite exciting. So yeah, that's where it came from. I think it's remains a very exciting thing to learn about every now and again.
Totally. That's fascinating. I would love to learn more about that. So now switching gears to rare diseases, obviously I can see how that gave you a good background in ultimately being able to contribute to rare diseases. But what got you specifically and personally excited about rare diseases?
Yeah, it's one of those things where I wish there was a beautiful story about this link between my evolutionary biology and seeing how that could feed into rare diseases, because obviously it does, and I think it really does help the work I do. But it's one of those cases where it was a bit of a chance occurrence that came up and brought me into this space, which is actually probably more common in the rare disease world. I finished my PhD. I wanted to stay in the city I was in, and there happened to be a job with this charity that I saw that appeared that looked interesting, and that happened to be what was then known as Find a Cure, a rare disease charity. And what I was looking for at the time was a role that connected me more with people, and a role that allowed me to try and deploy and use my scientific work in a way that was more relevant to the world around me. You get into a place doing a PhD sometimes where there's like 1 of 8 people in the world that care about your topic, and I think after so many years I'd got a bit tired of that. So I was looking for something like this, and it happened to be a charity that was looking to support people living in rare conditions. And as it so happens, in hindsight, that was a brilliant match for someone with the broad scientific knowledge I've got, and that desire to talk to a diverse community of people, really.
Oh, make that totally 100%. That's something I found having done work now in the rare disease space for a while. So tell us a bit more about Beacon. Now it's known as Beacon, it was Find a Cure. Kind of since you joined, what it's been focused on and what its evolution has been like.
Yeah, I mean, it has been a bit of an evolution over the last few years, but broadly speaking, we've always had the ethos at what is now Beacon, that we want to break down this isolation that people living with rare diseases feel. What we know is that at the point of diagnosis, it can be a hugely scary event and an isolating event for people living with rare conditions, often because the clinician themselves will know very little about it. And people are told, you're not going to meet anyone else with this condition in your life. You're kind of on your own to do the best you can. But constantly, the work we've seen, the work we're doing is that people forming and building patient organizations can help, really trigger a new community around that and help drive people forward and drive the field forward. Simply put, they can connect people with the same life experience. And that can just really make life a much more simple and bearable thing for people living with a rare condition, gives them an idea of what the future might hold. But we've seen groups that have driven forward entire research projects that have led to new treatments being developed. We've seen groups that have put in new clinical trial guidelines, new clinical practices in place, really transforming the field as a whole. So what we want to do as an organisation is help those patient groups to form, to grow, to professionalise their work. And we try and do that by providing accessible training, to provide abilities to connect with other people, whether that's in patient groups or in the life sciences space that can help them do the job. And hopefully to help them build their confidence and knowledge and skills to really push things forward. So it's quite broad work. It's really interesting work, and it intersects with that societal side of things right through to the in-depth details of research and how you can actually help people contribute to research in a meaningful way.
Yeah, no, totally. That makes a lot of sense. And, you mentioned a couple of groups that have had success being part of Beacon. That was actually one of the questions I was going to ask you is, we know Nick Thoreau's story with alkaptonuria, which is a tremendous one. But what are some other examples of groups specifically that you guys work with and things that they've achieved in the process of being part of the group?
Yeah, it's the specific group thing is always a really hard thing to think back on. You start looking back through the groups you've worked with and just seeing what breadth there is. I mean, we work with over 250 groups in a year last year, which is brilliant diversity. And when I look back, there's a few different things you see. There are just the formation of new patient groups is really exciting. So there's a group recently. We worked for a few years called Stargardt's Connected. So that's tied to an ultra rare condition called Stargardt syndrome, formed by a mother of a boy who was diagnosed. And, that usual story, wanted to do something different to support the condition and to limit the visual degeneration he was likely to experience. So we were really pleased that she joined the mentoring program and through that program founded a new patient group. Since then has been helping to fund research, to drive things forward, to build a new community, which is brilliant. And last week, I think it was a couple of weeks ago, was awarded the Prime Minister's Points of Light Award here in the UK. So recognised for her role in founding this charity and driving the landscape forward by the UK Prime Minister, which is a really exciting journey, which probably has spanned 4 or 5 years. I mean, it's a good way to come. We've got multiple different groups now forming different patient registries, trying to provide real clear captured data and information on the life history of people living with their conditions. So Timothy Syndrome Alliance pops out to my mind that have recently been putting this together and actually built a brilliant video about the diagnostic experience for Timothy Syndrome patients as part of Rare Disease Day campaign, but have been growing this registry for the last year as well. And this is an ultra rare condition with tens of patients probably globally. There's another group we do a lot of work with called Annabelle's Challenge, who focus on the rare disease type 4 Ehlers-Danlos syndrome. And they've done a huge amount of work in the fundraising space, had a really big community fundraising effort, but have recently been pushing through their work directly with the NHS to build an improved service for people living with VEDS, vascular Ehlers-Danlos, but then also to begin to push research forward in that space as well. And all of these are examples of people we've done a little bit of work with here and there, whether through mentoring, whether through workshops. Some of them have trained for us, some of them have been trained by us, and it's fantastic to see that kind of progress and how little parts of the work and engagement we've had have helped them move forward. But I could talk for many hours about it, but I think it's just trying to reflect there is this breadth of journey that we see from people, and the fact that they learn from each other is what's really encouraging.
Yeah, no, absolutely. That's one of the things I've also realized is that these stories, I mean, the actual diseases are in many cases very different, but the stories are very similar, both from the shock of the diagnosis or the diagnostic odyssey that we talk about, 4 to 9 years on average to get diagnosis, all the way to creating a clinical trial for different drug candidates. So being able to learn from each other and get that hope, right, that beacon of hope that we talk about is extremely helpful psychologically for many of these patients too. And these stories like John Crowley's story we had in the podcast, Nick Thoreau's, many others, gives that hope to a lot of these groups that I'm sure you guys do the same.
Completely. And Nick's story is an amazing one, right? And it's one you want to tell as many times as possible. But it's a case where things were in place and the right people were in place to drive it to this point of completion. So many groups we are working with are on that journey, and what we want to do is provide that support to them every step of the way, essentially. So whether they're just getting started or whether they're right at the end, we want to be there to help support that, and that support the individual patients for their mental health, but also support the people doing this leadership. Right, it's not easy being a Nick Sorrow at times. Right, you have to be able to have someone to turn to cope with the worry of, are you going to get there? And I think a lot of the patient group leaders we work with feel the pressure of that, and the pressure of representing that community of people living with that same condition. And we're seeing more and more of them connecting with each other and sharing their experiences, despite the great differences between the conditions themselves that they're representing, which I think is really encouraging and hopefully moves us closer to a place where there is more of a unified rare disease community rather than lots of different rare diseases, which I think is something we'd love to get to in the not so distant future.
Totally. Especially given how many people are directly affected, right? The estimate is over 300 million people around the world have the 7,000 plus rare diseases directly, plus hundreds of million more family members who have to help with the care. Um, I wanted to ask you about, so what's interesting about Find a Cure is that Elsevier started working with your organization when it was Find a Cure many years ago. One of our
Yes.
colleagues, Tim Hochter, and I think there was a hackathon done together with your team. And then now we're back to working together now that you're Beacon. And so I'm just wondering, from your perspective, how has that collaboration gone, and what are some things that we as like a global publisher, educator, research group can be doing to further support the rare disease community that in your eyes?
That's a really good question. I think it's always been nice to see a company of the size and scale of Elsevier being interested in the rare disease space, and what is frankly a small charity at Beacon. Particularly when we first started that collaboration, we were a very small team, and I think the ability to access the wealth of information, knowledge, and skills that exist within that company for an organization like ours and a field like ours is really exciting. So it was a real pleasure to work on that and see what potential there was in that kind of data and the analytics and the skills of the people within the company at the time. And it helps us think a lot about some of the drug repurposing projects we were trying to facilitate at that time and begin to move those forward. I think now at this stage, interestingly, we're at a place where this topic of repurposing is coming up again and becoming more prominent and more prevalent. And I think the role that companies like Elsevier can play is only bigger because you can nucleate this community. You have access to a wealth of information, a wealth of connections around the world, and can help to bring those people together to drive more projects forward and just highlight that importance of this topic of rare disease. We touched on already this concept of bringing a united rare disease community. I always think that there's no reason rare diseases can't be thought of like cancer, right? I mean, we think of cancer as a single challenge we're trying to beat. It's hundreds and hundreds of different conditions that happen to have the same broad expression, and we try and tackle in that same way. And there's a unified way to attack it. And rare disease can be that same thing. It's thousands of different rare diseases with different effects biologically, but fundamentally most of them are genetic, and most of them have very similar impacts on the daily life and life experience of living with a rare condition as a patient. And if we can begin to tackle those problems as a unified cause, we're gonna push things forward much better. And companies like Elsevier having an interest in this space, I think, can help spread that message and unify the field by highlighting connections between conditions and highlighting opportunities to push things forward, and highlighting the way that whether it's one good researcher or one good patient group or one good idea can really make a big change to the people at the coalface or at the receiving end of that condition.
Yeah, 100%. And actually, my next episode we're going to release after this one likely is with the new editor-in-chief of an Elsevier journal, an open access journal called Rare. So specifically creating one, just like there are journals called Cancer Biology, we've launched an open access journal called Rare that's going to have not just original research papers, but also patient perspectives and caregiver perspectives across different rare diseases. So hopefully that'll get us closer to that vision you mentioned, which is with the way we think about cancer, we think about rare conditions, especially because there's so many even though the conditions are often different, many of them are ultra rare single, genetic mutations or single gene mutations. And that's why you get sometimes ultra rare conditions is there's, 20,000 genes in the body. And so any one of those could potentially be upregulated or downregulated depending on different genetic or epigenetic changes.
Absolutely. Yeah. And that sounds like a great initiative, and brilliant to hear the different voices as part of it, because we really believe that you need to have all of the different perspectives in play and voiced and listened to drive things forward effectively in rare conditions. You need that patient view, you need the clinician view, you need the academic researchers, the industry. Bring that together, and you can absolutely solve the problems that any given condition is facing.
Totally. Um, so you mentioned drug repurposing, and
I
one
tend
of
to.
the one of the people we had on the podcast a couple months ago, it just introduced you to him, I know as well, or reintroduced you,
Hmm.
is David Feigenbaum from the Castleman Network and now Every Cure. Tell us about drug repurposing in general, and then your specific work on it, as well as any of the traction you're getting in Europe.
Yeah, it's a big question, a big topic. So David's obviously a fantastic representative of rare disease, of repurposing, of clinicians, an amazing guy to speak to, and I'm looking forward to catching up with him again. Um, Repurposing for me is something I've always worked on as part of this role, and it's very simple. It's recycling essentially. It's finding new uses for old drugs. It's finding a different way, a more efficient way to use the medicines that we already have out there to affect more people and provide more benefit to humanity, right? And in theory, it should be a really appealing thing to happen. But for a range of different reasons, what we've seen, particularly in the space where a drug's gone off patent, that it's been used, it's generic, it's widely available, it's very hard, therefore, to generate the right scientific evidence to allow these drugs to be frequently used for more different types of condition. And there's a market failure there essentially, which is very frustrating. And I think it can slow researching and limit opportunities for people that otherwise wouldn't have any form of treatment. So for me, drug repurposing is something that I think we need to be pushing more and finding more ways to drive forward, particularly because it does offer a route, theoretically and in cases in practice, to get a treatment to people more quickly and more cheaply than you would otherwise expect to develop a whole new treatment. And it also opens up a route which is more accessible for research by patient groups or by a small group of academics to move things forward. It can allow us to work therefore in areas that are ultra rare, that might not have the commercial appeal to some of the really large pharma companies. So that's why I think it's important. And as I say, we've worked on this for quite a few years, whether it's trying to think of new models to fund repurposing work, whether it's trying to drive forward and raise awareness about it. And over the last year, we've been part of a new European level consortium, which is called Remedy for All. And this is a platform that's been set up that's trying to drive and inspire people to do more repurposing research across Europe, which is really exciting. And we're trying to provide a range of services, ideas, expertise that will hopefully help to drive these projects forward in a practical way as well as a kind of inspirational way. So we're working with a few projects now, and we've got skills in identifying repurposing opportunities. We've got patient group expertise. We've got clinical trial design expertise. We've got preclinical expertise. We've got regulatory expertise. And the idea there is if you start a research project in a rare condition with a repurposed drug, we want to help you actually make sure that if it works, it can reach the patient and not just publish a paper and then not reach the patient and not deliver the patient impact. So it's a really exciting time for repurposing, because I think there's more and more of these type of projects out there. The work David's been doing, the work we're hoping to do for Remedy for All. There's a range of different groups currently now trying to explore how we can use existing drugs more effectively. And a lot of that has been inspired by what we saw as a response to the COVID pandemic, trying to find drugs that can solve a big emergent threat very quickly. Well, repurposing does that, and rare diseases need quick treatments as and effective treatments, and repurposing is a pathway to do that. So hopefully we'll make a big impact. We'll see what happens.
Yeah, I'm super excited. We're to not only shed more light into this and hopefully get some of our listeners excited about leading some of these projects or participating in some of these projects. There's a lot of great human capital who listen to this podcast. Hopefully we'll become, again, the clinicians and researchers helping rare disease communities. But then the repurposing stuff, I mean, now, especially with the rise of a lot of big data and AIs in the news every day, I think there's so many. We had Matt Might, who you may know from the Precision Medicine Institute at University of Alabama, the work his lab does, obviously the work Elsevier is doing with Pharmapendium, Intellect, and SciBite, among others, I think is pretty exciting.
Really exciting. And there's so many new ways to get new ideas now. And that's brilliant. And I think what we're hoping to do with projects like Remedy for All is to connect that, like, those new ideas to delivering to the patient, and crossing what they call that translational research valley of death, right? Finding a way to actually make sure we get through there to get a product that can reach patient, which is what we all want to see. And with such great ideas coming out of so many angles, if we could smooth that process, we're going to be in a very different place in 20 years' time, which is really exciting, I think, for the whole field.
Totally, totally. And again, part of what we've done this year, we call it the Year of the Zebra, is because it's the 40th anniversary of the Orphan Drug Act, right? That's why we even launched this initiative this year as opposed to last year or next year. And so the hope is that over the next decade, once we celebrate the 50th anniversary of the Orphan Drug Act, because of organizations like yours and initiatives, like Remedy for All and Every Cure, as well as the big data aspects around this, the AI developments, and connecting that to directly to Science Direct and other scientific databases, will hopefully go from the about less than 1,000 approved drugs for rare disorders to hopefully more orders of magnitude more than that. So, I think since we're coming up in time, I did have just a couple more last questions. First is most of our audience are current or future clinicians. And I remember when we had Nick on the podcast, Nick Soro, he was talking about a really influential clinician researcher named Dr. Ranganath at University of Liverpool, who really helped him and all patients and family members who have the black bone disease and finding that treatment for that. I'm curious, what are some things that our audience could be doing as clinicians and researchers to most effectively contribute to the work Beacon does and the rare disease community needs?
Yeah, it's a really good question, a big question. I think firstly, I have seen in the last 8 years or so working in this field that really you need, if you can get that one clinician, that one researcher with a proper dedication or interest in your rare condition, you can really move the field forward very drastically. You've got to be the right person, but people like Dr. Ranganath, people like Professor Tim Barrett that I know in Birmingham, who've been driving forward research in Wolfram syndrome, they can go from there be nothing to screening a drug, to then setting up the first preclinical testing, to drive a clinical trial that can ultimately get you to the place where there could be a treatment that rare condition. There's not a huge team around them. There's that core person that's driving it. I think that is something to be really aware of. For me, for people out there in the medical profession, there's a few different things that you can do. Firstly, is to try and familiarize yourself with what are the red flags for rare disease diagnosis, if nothing else. There are certain patterns you can see in that diagnostic odyssey that get missed too easily, that could say to you, hang on, there's something odd going on here. There's a big picture that we're missing by looking at every little thing in isolation. Can you identify the odd patient just going time and time again for re-diagnosis? Because if you can do that and intervene and push forward for some kind of genetic testing or actually a different look at this, you could transform someone's diagnostic odyssey from a couple of years, from 10 years to 20 years to a couple of years or a few months. And that can make a huge difference to that individual and really demonstrate that you understand the importance of listening to that patient, listening to the person to get you to that place of good diagnosis. That's one thing I think anyone can do, because that makes a huge step forward. And I think the other thing is, if you can find that time just to make a little nod to rare diseases in your work, pick one condition that's in your field that no one else you've heard in your field is talking about, and just learn a little bit about that. Maybe find a patient group out there that are doing on it, and just seeing if you can just provide them a little bit of help. Give them a few hours a month just to sit on their science advisory board. You could really make a difference to that patient group when no one else is paying attention. And that little bit of expertise could be transformative to that rare condition. And there's so much demand on clinicians right now. There really is. But if you can find those few hours, I think you can really transform a space in a way that is very hard for you to do in those big sweeping grand health issues we're all talking about, whether that's in cancers or heart disease or whatever. Just find that one rare condition for a few hours. I think you make a real difference.
Yeah, that's wonderful advice. That's really, really practical. And also, in the clinicians we've spoken to and other examples that have come up on these podcasts, it's clear that those clinicians who do take the time to do that, not only could they potentially discover a new way of looking at maybe the more common conditions that could lead to breakthrough discoveries. I mean, we keep talking about, there's so many examples of that, like the familial hypercholesterolemia example leading to development of statins, but also just as far as burnout goes and feeling disengaged from the work, you have these individual discussions with rare disease parents and patients, and like the amount of gratitude they have for you for doing this work is definitely more like they're the models for engaged patients and grateful patients, that I think if other disease groups had patients as engaged or as committed to finding cures or therapies, we wouldn't have as many chronic conditions, as many people suffering from diabetes or hypertension or other kind of preventable diseases.
Yeah, I think it's an interest that gives back as well, right? You're gonna really get opportunities to engage with people as people to understand their personal perspective of condition and illness in the health system, and see how you can directly affect that very quickly. And that I think it is quite enriching. I think those people that do latch onto rare diseases tend to get stuck there because of the experience they have and the breadth of knowledge they gain and experience they gain through doing it, which is exciting. There is no path in medicine for rare diseases, right? And that's a challenge in itself. But I do think there's a huge amount of opportunity for people to enrich their careers and enrich their life by engaging them.
Totally. Two last questions for you. The first is there any advice you want to leave our audience with about approaching their careers in healthcare and research and in medicine in general?
A couple of things I thought of. I think firstly, I think people are really important in the work you do, and just they help change the way you work. They can provide that sort of motivation behind what you're doing in medicine. You dive into medicine or research because you want to try and help people. So try and find a way to connect with that audience as much as possible, and hear and give them a chance to tell you how you're helping and what help they need, because that really means you can direct the work you're doing in a way that makes a lot of sense. And then the other one is just to try and be open to new opportunities and follow the most exciting opportunity. I didn't plan to be in rare diseases. I didn't plan to be in charities, but there was a nice opportunity that came in front of me, and I'm still here 8 years later and enjoying life and doing something that I think matters. So you really never know where opportunities can take you. So if it excites you at the time, trust yourself, give it a go, and dive in, I'd say.
Love that for sure. Final question, anything else that we didn't cover that you want to leave our audience with?
Just very briefly, I think for the work we do at Beacon, it's all about those patient groups and where they can take you. I've already said, take your time to try and join one of those groups and help them if you can. Recognize those groups out there are so willing to do anything that they can do to help their community, but they are starved of resources, of time, of money. They're doing everything on a shoestring. When you interact with them, appreciate what effort they're putting in, what time they're putting in to try and sacrifice. Most of these people are parents themselves, caring for someone with a rare condition, and doing this in their free time, in the evenings and weekends. And any little bit you can give to support that mission, if you're in that position, will be transformative to them. So yeah, bear that in mind in those interactions, and I think you can't go wrong with how you push forward with rare disease patient organizations.
Awesome. Well, those are some great words to end on. So, Greg, thanks so much for taking the time to be with us on the podcast, but more importantly, for the work you've done over many years to help the rare disease community.
No, thanks for the chance. I've loved talking to you, and yeah, really, really excited to see what comes from the year of the zebra. So thanks, guys.
For sure. And with that, I'm Shiv Gaglani. Thank you to our audience for checking out today's show. And remember to do your part to raise the line and strengthen our healthcare system. We're all in this together. Take care.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.